Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 11 starts now.
Reopening the country in 3 phases.
We are not opening all at once, but one careful step at a time.
President Trump announcing new guidelines on when and how states should restart their economies.
Glad you're with us tonight for Local 4 News at 11. Those guidelines are meant to help governors, but the states will not be forced to follow them.
The guidance does not set specific dates, but each state would need to show a downward trend in cases over 2 weeks before they can enter phase 1. That's when venues such as restaurants and movie theaters can open with strict physical distancing. It's not until phase 2 that schools, daycares, and camps can reopen and non-essential travel can resume.
Only in phase 3 can offices and work sites resume normal staffing protocols without any restrictions. Susan McGinnis in Washington with a closer look at these new guidelines.
As the coronavirus death toll surges past 31,000, President Trump rolling out guidelines to gradually restart the U.S. economy and get Americans out of isolation.
We are not opening all at once, but one careful step at a time.
The plan involves 3 phases dictated by how widespread infection is. Phase 1 continues social distancing and allows some businesses to reopen under strict conditions but keeps schools closed. Under Phase 2, non-essential travel can resume and bars and schools open. And in Phase 3, Americans largely return to normal life.
You want to call it the new normal, you can call it whatever you want. But even if you are in Phase 1, 2, 3, it's not okay, game over. It's not.
The president says those phases will be decided by governors based on conditions on the ground, and he estimates 29 states can begin the process relatively soon.
About those states that are in great shape already,
yes,
they will be able to go literally tomorrow. Yeah.
The guidelines contain no specific dates, and the phases are dictated by one factor more than any other: coronavirus.
It may very well be, as we go the cycle around, that there'll be this virus that wants to come back to us. I think we're going to be able to handle that thing.
One doctor evaluating the plan says the key to success is testing.
If we have that everywhere, that's really how we're going to get out of this the most safely.
While officials in some states are eager to get back online, others reluctant until testing capacity reaches the levels that Washington has been promising.
Susan McGinnis, Local 4.
Well, tonight, Local 4, along with Channel 2 and Channel 7, hosted a statewide town hall with Senators Debbie Stabenow and Gary Peters to discuss the federal response to the COVID-19 crisis.
And to ask the questions that we've been getting from you on a daily basis. Mara McDonald live downtown tonight. Mara, what we did not want was a political partisan complaining session. How'd we do on that front?
Oh, I think you did great, Devin. I mean, just from my personal perspective watching it, you know, so much of what we see every day from people is how they view this through their political lens. Credit to the senators. They weren't doing the blame this guy, blame that guy. They answered questions that they were asked.
And we are delighted to have with us this evening Michigan's 2 members of the United States Senate.
For an hour, both senators from Michigan answered questions that were at times very pointed. Devin asking one we get constantly: why, when this country is in crisis, does Congress pass bills which are full of things unrelated to the crisis? Devin calling out monies included for a sunscreen manufacturer and the Kennedy Center in the CARES Act, designed to help keep people and business afloat.
There are things in there that you don't personally support. So it's always a big frustration, I think, in our democracy when we're trying to do something quickly.
It drives me crazy when I see those things in the bill, particularly when we're trying to deal with this immense crisis and come together, that you have folks that try to stick in and sometimes are successful in sticking in these things that have no basis being there.
And what will it take to get our economy back up and running? Both say constant testing is key.
We need to have the kind of testing where, just as the mayor of Detroit has been able to do with a 15-minute Abbott test for police officers, you take the test in the morning, you get the results immediately, you know you're okay, and then you can go to work.
And in the next round of stimulus, what are they looking for? Both say more monies for small business, hospitals, and our food supply.
We all knew when we passed the CARES Act, it was a substantial piece of legislation providing over $2 trillion in aid to our hospitals, to working families, to small businesses. But we also knew that we would have to do more.
Back here live, both agree that more has to be done, and both repeated consistently that the way to get things opened up and back to some sense of normalcy is testing, testing, and testing. We're live downtown tonight. I'm Mara McDonald. Back to you.
Yeah, so many feel that's the mantra. All right, Mara. Kim?
Today, Detroit Mayor Mike Duggan says the city continues to see a decline in numbers and that the social distancing guidelines put in place are working to combat the spread of the virus.
The numbers in the city, again, it's all trending the right direction. Hospitals are all reporting that their caseloads are easing, that the ventilator usage is easing, and we are now 1 week since the 1,000-bed TCF Field Hospital opened up, and they still are at 16 patients, the same as yesterday. They thought they'd be at 250 by the end of the first week. It is truly remarkable what the people of this city have done.
Well, Detroit's Civil Rights, Inclusion, and Opportunity Department hosted a forum tonight to discuss how COVID-19 is hitting the African-American community especially hard. They identified problems and discussed solutions. Jason Colthorpe is live in Detroit to break it down for us tonight. Jason, good evening.
Good evening, Kim. And this story starts with statistics, starting with 15% of the state's population is black, but they make up 33% of COVID-19 cases, which has a 4% death rate in the state. But amongst blacks, it's 40%. And of the things talked about tonight, they said we can talk about statistics, but if we're going to, we have to talk about the hard truth statistics, like the number of people living in poverty in Southeast Michigan. 3% of them are white, 24% are black.
If you never knew what the term social determinants of health was before, here we are.
Call it a virtual town hall meeting on race and COVID-19. A panel of experts from the city and the state shared thoughts and answered questions, starting with why are blacks disproportionately contracting COVID?
Critical infrastructure workers, grocery stores, running the public transportation and whatnot. They're lower income. We know they're more likely to be, therefore, people of color. We talk about going to the grocery store. People can't go to a grocery store and spend $500 at one time so they don't have to go back for another 6 weeks. That doesn't make any sense.
It's not that race is invisible. It's that race has been ignored. It took this particular pandemic to make people understand that there are underlying social ills.
The city nor the state can fix the social ills while fighting the coronavirus. But the panelists agreed it's important not to again ignore they exist after this latest crisis has exposed them.
Living in concentrated poverty and don't have access to decent jobs and decent health care, and where health care itself is not as accessible as it should be.
People out shopping at a big grocery store in Detroit confirm some of those urban stereotypes that can directly lead to lower income people contracting the virus.
The Myers, it was another one, I think in Livonia, they're cleaning off baskets for your customers as you go in. You go into this one, they're not cleaning off your baskets.
A couple of solutions that were discussed, what you might think, jobs and education. With education, you're talking through K through 12 funding. It needs to be higher for Detroit students, and jobs. They focused on the community college level, making sure people graduate to get jobs to not just sustain wealth, but to grow their wealth. So the next time Detroit can be much stronger for the next crisis. In Detroit, Jason Colthorpe, Local 4.
All right, Jason. Michigan's Attorney General Dana Nessel says she has stopped the Jeffersonian apartments in Detroit from illegally evicting nearly 80 tenants, most of them elderly. Today, Nessel sent the operators of the apartment a cease and desist letter after she says they hand-delivered dozens of letters to tenants telling them to pay their rent or move out within 7 days. Of course, last month, Governor Whitmer signed an executive order making it illegal to kick out people unable to pay their rent during the pandemic.
All right, let's go ahead and check in with Ben. We've got good news and some bad news. Good news is tomorrow's Friday. Ben, I'll let you tell the people the bad news.
Well, thank you. I appreciate you giving me that honor, Kim. How about this? At least we're not seeing the 8 inches to a foot of snow that they're expecting in central parts of Illinois. Check out where this storm is right now. This is what's moving towards us, and you can see those dark blue shades down there. It's this band here where we're expecting that accumulation to maximize up to a foot of snow just south of Peoria as we get into tomorrow. But here's how we expect things to go tonight. Clouds are going to continue to thicken up overnight. We're going to stay dry until just after the sun comes up, and that's where we're going to see that snow start to develop in the south zone first, and then it's gradually going to spread through the north as we get into the afternoon. Not all of us are going to get snow. In fact, here at 11 a.m., as that snow really gets to its peak, that's about as far north as we expect that to get. Temperatures are going to stay in the 30s tomorrow. We're going to see that snow at least through mid to late afternoon. Coming up, we'll tell you how much to expect, even though I don't think we'll be shoveling. There definitely will be some accumulations on the ground, and we'll run that down for you in just a few minutes, guys.
All right, Ben. Still ahead, can mosquitoes spread the coronavirus? One of the more frequently asked questions sent to our Dr. Frank McGeorge. He'll have the answer coming up in a minute. Sean.
Those images, just unforgettable, shocking images of people's loved ones who passed away of COVID-19 here at Sinai Grace Hospital, stacked up in rooms. Well, tonight, the state has seen enough. They're stepping in. How the state intends to help this hospital.
Gyms are closed, no trainer, no weights, no problem. How to get a full body workout within the walls of your own home. Fitness Friday, tomorrow morning at 6 a.m.
The stories that really keep me going are the ones that showcase the best of who we are as Detroiters. So many of you reached out to us asking how you can help. Well, one thing we can do is to make sure our frontline workers aren't saving lives on an empty stomach. It seems so simple, but it's so meaningful. That's why Food for Frontline is helping keep our essential workers fed and fighting for our communities. You can donate now at clickondetroit.com/frontline and stay with Local 4 for the moments that matter.